Hi, Miss Washington. I'm Anush, your nutrition counselor. It's nice to meet you.
You as well.
I'm here to talk about the overall diet after your diagnosis of stroke. Is this a good time to chat?
It is, yeah.
Perfect. So I was talking to your speech language pathologist, and she told me that she performed this bedside swallowing assessment test with you. How did it go?
It didn't go great. I definitely had trouble swallowing. It hurts to swallow, and I don't have a lot of use of the right side of my body. So I'm having trouble feeding myself too, because I am right-handed. So using my left hand's been a little bit difficult. So
Yes, I understand that it can be hard, but this is important just to see what what type of dysphagia you have, and to see what types of food I can help to provide you with. So she also performed this barium swallow test with you, and she told me that you have this esophageal type of dysphagia. Are you familiar with dysphagia? Do you know what dysphagia is?
I've heard it just since I've been in the hospital, but I haven't really been explained it at all. Can you tell me a little bit more about it?
Yes, of course. So dysphagia is the difficulty swallowing in simpler terms. It's just difficulty swallowing, and just like you told me, it's hard to swallow the food. And when someone has dysphagia, it can be due to stroke or many other disease complications. So it's important to work with you and provide you a little bit of nutrition education, give you some tips to minimize the problems associated with it. For example, it may cause aspiration, and aspiration is when the food may go to your lung. It may end up into your lung, and it will be even worse. So we're trying to prevent this from happening. And this is why the nutrition education will be important. So I usually share a handout with my clients just to go over the food types that they can include or exclude from their diets. Will this be okay with you to share the handout and go over some tips?
Yeah, that would be great. I would love to learn more about this.
That sounds great. But well, before starting it, just want to quickly go over your 24-hour recall and see what you're eating in like general in a general day. Like, what do you eat for breakfast, lunch, dinner, like any snacks in between? Sorry, I meant like before being hospitalized.
Yeah, of course. So my breakfast, it usually is comprised of cereal with some milk. I usually stick with 2% milk, along with some OJ. I also would eat a banana and then my coffee with sugar and cream as well. Lunch, I'm a big fan of soup, so I would eat some chicken tortellini soup. I would pair that with saltine crackers, some fruit like canned pears, and then some iced tea on the side with that. Dinner, my dinner included fried pork chops. I would also include some veggies like sweet potato and broccoli. I would put margarine on those, on the side of those. And then I always try to include some fruit as well. Dinner usually was canned peaches, iced tea with dinner as well. I'm not a real big snacker, so I didn't really eat a lot of snacks, but I have been trying to focus on limiting my sodium intake and then trying to stay away from like greasy and fried high fat foods.
That's already great that you have started making these changes. Let me try to share my screen and offer you some more tips.
Great.
Can you see the handout?
I can, yes.
That's perfect. So this is the dysphagia diet level 1. And it is, have you heard of this diet?
From what you just told me, I understand a little bit better. I just didn't know there was different levels. So what is level 1 comprised of?
Perfect. So level 1 diet is the diet which is comprised of smooth textured food, for example, pureed foods, like very well mashed bananas or very well mashed sweet potato, not sweet, but like regular potatoes. I saw that in your 24-hour recall you were eating sweet potatoes. You can substitute that with mashed regular potato for it to be easier to swallow. But let me go over this handout so it will be easier for you to understand. So foods that you can eat include pureed breads, smooth puddings, yogurts, which can be either plant-based or regular yogurts, pureed soups, or some vegetables, which can also be pureed, but it doesn't have to include any pulps, chunks, or seeds, because it may cause aspiration. It may go to the lung and cause aspiration. Do you have any questions about these types of food?
I don't think so. That makes sense that I could like substitute my whole potato for like pureed potatoes. What about like protein? Am I allowed to have protein on this diet?
Yes, you can have protein, for example, from meat, but it should be blended with a blender. I'll talk more about it in here, but it's usually blended. You want to use either, for any type of food, you want to use either the whisk or the blender or the fork just to mash them very well, so it doesn't cause any problems with aspiration.
Okay.
So here are some pictures for you of the foods that you can include. But let's talk about the foods that you should try to avoid. So these are the non-pureed breads. Unfortunately, you cannot have any breads because the breads are only the type of bread is the pureed bread. There are a lot of commercial products in there you can purchase. They are already pureed breads, or you can make it on your own, but I would recommend purchasing it because it's already modified for the patient, for these types of patients. So bread, you can still have bread, but not the regular type.
Gotcha.
You would like to limit the avoid the cereals, and there are the types of cereals which can be included in the diet, but those are again like well mashed types or well cooked and blended. For example, the oatmeal can be good, but there shouldn't be any chunks left. Any crackers are not allowed in this diet. Jellos are okay, but jellos with fruit pieces, I included in here, are not allowed because the fruit pieces are a little bit harder and then they may still cause aspiration. Thin liquids, water, coffee, and canned fruits are not allowed because these are types of liquids which may cause which have lower viscosity and they may cause problems. But if you like to include the coffee, for example, you should thicken it with the thickeners. For your orange juice, we're gonna go over your 24-hour recall again, but just the general info for the orange juice again, you can use the thickener. Do you have any questions? Does this make sense?
Yeah,
I know it's a lot of information.
Yeah, it does make sense. So with my cereal, obviously I like to eat cereal in the morning. You said oatmeal. Is there any other sort of cereal that I'd be able to substitute for breakfast?
Yeah, and anything that is easier to swallow. Maybe I would suggest baby cereals.
Oh, okay.
And infant cereals.
Mm-hmm. All right.
So they're pureed and easy to swallow.
Gotcha. Okay. Yeah, I think that was my main question. So
perfect. So, and then the thickeners are also important in here to include, especially the liquids that I mentioned before. I'm looking at your 24-hour recall, and I can see that you're drinking coffee and then orange juice. You can add these thickeners to your liquids to thicken them a little bit, because when they're thick, their viscosity are not there very low, and then they are easier to swallow, obviously.
Oh, okay.
And the types of thickeners that you can add, I have them here. You can add mainly for the liquids, it's usually the commercial products which are used, but you can also use them maybe purids, what do you call it? I forgot the name, sorry. For the milk powders, for example, can be added. Those are great too. But most of my patients are using these commercial products. And what's great about these products is that they're easier to follow the directions, because they have the directions on the label and it's easy to follow the directions. Just the brand types can be thicken up, thicket, or ultra thick types.
Okay.
Yes, and do you have any questions before I move forward?
I don't think so. Not right now, at least.
So it makes sense, correct?
Yeah, so I would just add the thickener to whatever liquid I want to drink, correct? And just mix it, and then I'm good to go.
Yeah, that's perfect.
Okay, yeah, that seems pretty easy.
Mm-hmm. So based on your 24-hour recall, you can try to make some goals to change the food textures, or just pick one suggestion from this handout to make goals. Just one goal is enough for now. What suggestions would you pick from here to make it, like, the changes?
Well, I really like to eat my fruits, so I think incorporating those pureed fruits at every meal
Okay.
is definitely going to be a goal of mine, just because I do like to eat fruit. So I want to keep that in my diet as much as possible.
That is great that you're trying to keep the fruit in your diet, because that can also help you with managing your lipid levels, because I've also talked to the doctor about your lipid panel, and those were out of range, but we can monitor that later. For now, that's a great start. So for the types of fruits that you were including in your diet, is the banana, but you have to puree it to make it easier to swallow.
Okay, and do I just puree that with like water, or can I use juice? What do?
Yes.
Oh, okay.
You can use them, yes, and on top of that, you also want to add a thickener, maybe a it also has a little bit of cornstarch because it's potato, obviously, but you can also add a thickener to it if you're using a little bit more of the liquid.
Oh, okay.
Okay, so the goal is trying to repeat back to see if I'm not mistaken. So you're trying to keep the fruits in your diet. For example, the bananas. You're going to eat mashed bananas.
Mm-hmm.
And make it thickened for you to be able to swallow it, correct?
Yep. I think I might also, to me, honestly, the pureed meats don't sound too appealing, so I might try to incorporate more yogurts to get my protein in as well.
I understand. It's okay, we can start slow, and this is a great start. I would like to just tell you that if you have any questions, you can always reach out to me via email, or you can also text. I can send you my phone number. And for now, do you have any questions before we finish?
I don't think so. You explained everything very well. So I do understand my diet a little bit better now. So thank you.
Thank you so much, and have a great day.
Thank you. You as well.